Hi, my name is Kim Holman. If you're watching this video, you likely have already made an appointment with me. In this video, I'll go over some things that will help you prepare for your session. Here's a little bit about me. I've been a licensed massage therapist since 1993. I often attend continuing education classes as I love knowing details about how our bodies function. This has given me a variety of tools as well as many perspectives about the body, including how our mental and emotional states affect our physical well-being. My target is to empower you to have wellness and balance in your life and assist you with bodywork to support you in your healing and growth process. Therefore, each session is customized based on your particular needs. Our beliefs, judgments, decisions, and trauma, including those passed to us through the DNA, all have an effect on our physical well-being. In my sessions, I may include a process called the recode to help you shift a perspective that may not be serving you at this time in your life. This allows the emotions to drop about an event, for example, while keeping the wisdom of what was learned through the experience. This recode process empowers you to have choice about how you respond in similar events in the future. By watching my video, What is a Recode, prior to your session, you will be prepared for a recode if we feel it would be beneficial to your session. Here are the primary types of bodywork I use. Fascial Counterstrain is the primary technique that I use. It addresses strain patterns through the body systems, such as the muscle system, veins, arteries, bones, nerves, and organs. For more information on fascial counterstrain and to see what it may look like in a session, see my video, What is Fascial Counterstrain? You can also visit the Counterstrain website at www.counterstrain.com. Craniosacral work is almost always included in my bodywork sessions as it can allow the entire body to be in balance or not. I've had 3 formal types of training for craniosacral bodywork, and the basic premise is that what's happening in the head needs to be reflected in the sacrum and the pelvis, allowing all of the other structures throughout the body to regain balance. On occasion, I use myofascial sculpting in a session when needed. I created the term myofascial sculpting because of the unique way that I use massage cups and gua sha tools in combination. You may know gua sha as the scraping technique. I choose to use these silicone cups. They're easy to use and clean, and this is the primary gua sha tool that I enjoy using. I enjoy the effects of myofascial sculpting. The cups lift the superficial fascia, and the gua sha tools gently release the neighboring muscles from each other, creating greater ease and movement in your joints. For more information, see my video, What is Myofascial Sculpting? A common denominator in all techniques that I use involve the fascia. It's in every cell of our body. In Thomas Meyer's book, Anatomy Trains, he talks about the fascial lines that we have throughout our body that can become stuck in one area but cause problems in another. As I work with a person's body, I keep these in mind. For example, the arm line goes from the fingertips all the way across to the other fingertips, and fascia can get stuck anywhere along that line and cause problems at that point or somewhere else in the line. For more information, see my video, What is Fascia? Your comfort is very important to me. Here are a few things that can make your session more comfortable. Please wear or bring pants and a shirt without buttons, buckles, zippers, etc. These often get in the way of measuring bony prominences or palpating tender points. Also, jeans or tight clothing can impede movements sometimes necessary to perform counterstrain techniques. For your comfort, there is a heated pad available on the table, and a blanket can be put on you as well. Please let me know if you are uncomfortable in any way. I will do my best to accommodate you. To begin a session, we'll start off by reviewing your health history and what you would like to achieve in your session. It is helpful for me to know what positions or movements are difficult or painful. I will assess you in that position of discomfort. If you'd like to incorporate a recode in your session, then we'll set up that structure. To start the hands-on portion, I will use a variety of assessment tools. Visually, I will assess by observing your movements and also mobilize joints to see what areas might need support. Here's an example of an assessment. So your left rotation's a lot easier.
It's easier?
It looked like it. Did it feel like it?
No, it feels the same. I just did it slower.
That feels the same?
Yeah. Well, yeah, for some reason it's a little faster in that direction.
One common denominator in all sessions is that I could end up assessing any bone in the body for a tender point or how well it moves. Let's go over a couple of important areas. The rib cage holds the heart, the lungs, the liver, and many blood vessels. By using a mobility assessment for the joints, I can locate the stuck area and scan to see if it's a viscera, an organ, bone, blood vessel, etc. The pelvis is made up of 2 ilium bones and the sacrum. These 3 joints should be able to move freely. This is what it will look like while assessing on the table. At the end of the session, depending on what we did, I may walk you backwards down the hall to reset your nervous system. This allows for quicker integration of the changes made in the session. I intend the sessions to be balanced and that changes are gentle, so that there is little to no treatment reaction such as headaches, joint aches, etc. If I'm aware that you will experience an uncomfortable treatment reaction, I will absolutely inform you. There is always the possibility of unexpected treatment reactions, and often it's due to dehydration. Super easy fix. It's always a good idea to drink extra water before and after a session. Ideally, we drink a ½ ounce per pound of body weight daily. If you're sweating in a warm environment, 1 ounce per pound of body weight keeps your body hydrated and gives your organs the needed water to function. For more information, see my video, Why Drink Water. There is great complexity in this skin suit called our body. I have been studying it for over 27 years and there is so much more to learn. I enjoy sharing information about the body and how it works, so feel free to ask me questions. I hope this information has been helpful. If you have any questions, feel free to text me before your appointment.